South Africa's biggest hospital, Chris Hani Baragwanath, delivered 7 New Year's Day babies early this morning. Gauteng Health MEC Nomantu Nkomo-Ralehoko visited the hospital to welcome them. The MEC celebrated with their mothers and offered advice to teen mothers.
We have 7 today, although some of the mothers were still giving some birth. Out of that 7, we have 4 that are boys and 3 girls. And I was not happy because last week at least we had more girls than boys. So boys now were more today. Another thing, I'm sure you are worried, why 7 only at Para? It's because of Chabulani Hospital. It has eased up our pressure now. Some of the mothers gave birth at Chabulani Hospital. But usually in a month, what we do is 1,450 to 1,500 at Para only every month that we are getting.
Wow, that's quite a significant number there. So do we have the official numbers for the province in its totality?
At the moment, we don't have it. The team is still updating it because some of the babies were still coming in this morning. So quite a number of them. I know we'll get a huge number and we'll definitely update you once we get that number.
Okay, MEC, now we also understand that the maternity ward at Bara will be undergoing some renovations. What are some of the details that you can share with us about this?
Plans are already there. The team has assessed the ward and the DIT team has been there to make sure that the work can start in this financial year. So soon that ward will be changed. In fact, I've made a commitment that come 31st and the 1st of 2023, we will be having a different ward as we're having today. And the other thing is the capacity that we're working on, because we don't have many of the nurses that are working in that ward. In fact, it's a general issue in the whole province, but already we have plans in place. We will be taking out some positions now, employing a number of staff, especially midwifery. But again, I've said to the team, we want to make a call to all the retired nurses. When they leave or when they prepare to leave, we want them to train the young nurses that are coming into that area so that we are able to ensure that whoever gets there is the person that will be able to do exactly what all our old midwifery were doing before, of taking care of those mothers, of ensuring that we don't have a number of cases of litigation. Because if you can check our number of litigations in the province are coming in the area of midwifery, where people are giving birth, where they didn't get care, some they didn't go for tests before those checkups that you need to do. And again, today we're encouraging parents again to ensure that the young mothers, they don't drop out at school, because most of them are young mothers, but some, they must learn to breastfeed their children, and they must make sure that they work very closely with them, protect them so that they are part of the development of their children, which is something that we don't do and don't encourage them. We think that when they give birth, they can dump that child and forget about the child, or they can dump their lives themselves and not move on and go back to school once they have young people, they are young mothers.